Hello, my name is Sukumar Ranganathan. I'm the editor of Hindustan Times, and with me is Binayak Dasgupta, who is also an editor with Hindustan Times. And we are going to be speaking about COVID, which is pretty much all that Binayak and I have spoken about for almost a year. We
Yes,
we first started talking about it in December. I think the first story we carried was on December 31st, right?
yes,
And we knew even then that it was going to be big.
yes. It was a small wire copy that we had from China saying that there was this mysterious disease that was spreading in Wuhan, and doctors at the time did not know what was causing people to come in with these symptoms of pneumonia. And initially, the parallels started to pour in with SARS, which had also begun in China. And later on, I think in January, when we started to really pay attention to what epidemiologists and other people were saying about how quickly it was spreading, uh, we discovered slowly that it goes from between spreads between humans and that it can spread without symptoms. But at that time, till January, it was still a
Yeah,
problem.
till mid-Jan, I would think, right? I mean, there was still a lot of opacity about what was happening. WHO didn't tell us anything about how the disease was being transmitted for the longest time. I think they believed China's claim that it didn't jump from human to human, that it was only moving from animals to humans, that it was zoonotic. And we didn't know how it was spreading. In fact, we didn't even know about aerosols till much later. Uh, but I remember that one of the things that we did early in those days was that I know this is probably a wrong adjective to use, but we went big on the disease, didn't we? I mean, we put resources on it, we got lots of people to write about it, we started covering it in depth.
Yes, it was also the mystery of it, and trying to figure it out while even as scientists were almost completely unaware of what yardsticks to use to determine what this could be. In terms of speed, for instance, on how it spread, it turned out that one person could pass it on to between two and three people, and that's when we first realized that this had a pandemic potential. It was somewhere around February that it started taking hold in places in Europe. By February end, I think Italy was really
But
badly
India
hit.
didn't really worry about it till well into March. I remember in February I had to go to Chennai on a personal visit, and I flew. And I, of course, took a mask. I wore it through the airport, through the flight. I was the only person in all of Delhi airport wearing a mask. I was the only guy on the flight with a mask, obviously. I also had these wet wipes with which I cleansed all the seating and everything. And I had a bunch of people looking at me very strangely. That was in early February. But I think India really woke up to it in March.
It did, and part of that reason was because we had such conflicting information about how it spreads and what to do for it to not spread. If you remember, WHO famously was in this controversy over whether we should use masks at all or not. It wouldn't be until mid-June, if I remember correctly, when they finally made a very clear-cut guidance that everyone should wear a mask, especially when it's spreading very rapidly in an area. And that was part of a lot of uncertainties at the time when it came to masks, whether we should lock down enough, whether we should close down enough to avoid transmission,
Yeah, we
or
we
if
we
different
we,
medicines.
we knew pretty much nothing, right? I mean, there was this big thing about fomites, surfaces being infected, and I think in the history of the infection, we both read
Right.
pretty deeply of this.
Yes.
I don't think there is a single instance of a person being infected by a surface. So I think we've all spent like lots of money on surface cleaners. If you go to my room in the office, you'll see all these cans with various kinds of sprays, one for clothes, one for surface, one for hands. But I think all these things have pretty much come to naught. But the thing that really amazes me is that in the first few months, we knew very little
Mhm.
to start with. But equally amazing was the speed at which we started to understand things about the virus, right? I mean, how it was transmitting. There are still lots of unanswered questions, but what people were responding to, because I remember for the first 2 3 months, everyone pretty much thought it was a respiratory tract infection. No one really thought of it as anything else.
And a part of this sudden awareness is because of this unprecedented level of scientific resources that were thrown at it. It was not just epidemiologists, but also mathematical modelers and scientists looking at genetics and virology. And the key inflection point maybe came shortly after the first peak, when a lot of people started getting infected, and they started showing symptoms that were not just that of a respiratory virus. And we started to realize that there was a autoimmune component to it, perhaps because it was causing a lot of damage to other organs. And that's when doctors really figured out that you could do at least some things to avoid fatalities.
A lot of the responses in the first phase were really non-pharmacological interventions, right? I mean, things like lockdowns, things like quarantines, which don't really um, work on the human system or don't really increase your immunity in any way, but just prevent the chances of the infection continuing to transmit, break the chain, as they would say. And I remember back in the day, there was this Imperial College model that all of us were looking at, which spoke about the ideal length of a lockdown. And one of the things that I still remember is that it said you had to have one lockdown for 49 days, or you needed to have a bunch of lockdowns over a slightly longer period of time than 49 days, but with gaps of 2, 3 days in between so that people could sort of exhale. But it turns out that even 49 days clearly not adequate because India had a 68-day lockdown, albeit with various restrictions eased over that period. But it didn't help our cause. I think we still went to this trajectory that we saw, right? I mean, the first wave was pretty brutal in this country.
Exactly, and that was also because we did not sort of understand what we must do with lockdowns to pair it with other efforts that to make it work. Because the idea was, in addition to breaking the chain, was to flatten the curves so that our hospitals and our resources can keep up with the number of infections, because it would peak there. An infectious disease is of such a nature that it will start spreading once you reopen cities, you reopen towns, you reopen countries.
And of course, we didn't get our testing right till very, very late. I remember when India, um, I think when they crossed a million cases, which was when? July?
July. We remember.
I remember writing a piece where I said that in India's aim should be to test a million people every day.
By
Uh,
August 15th.
yeah, so that by August 15th you
Correct.
achieve a certain milestone. And uh, everyone thought it was foolish, but we were just not testing adequately. The initial restrictions for the initial conditions for testing were just far too stringent. They were just testing people who were very symptomatic, or they weren't even testing direct contacts. If you remember, they would only test direct contacts if the contacts turned symptomatic, and which is pretty silly in the case of a disease where uh, many of the people are asymptomatic. And we now know that this proportion is anything between 30% and 40%. I mean, some people thought it was higher.
Right.
It also turns out, according to more recent research, and this is what we were talking about, you keep hearing and learning more about this. It also turns out that the chances of an asymptomatic individual infecting someone is just about a fourth of the chances of a symptomatic individual infecting someone, which, when you come to think of it, is probably also because of the viral loads that are present.
The fact that everyone got testing wrong, India and a lot of other countries, even some of the rapid test kits right now that we use are not very good. And that just sort of again reinforces the challenge that we face with this virus.
And I think initially we didn't test enough. I think our tracing left a lot to be desired. Every time things would come under control, we'd take our eyes off the ball and we would stop tracing, which pretty much happened in Delhi, right? I mean, after the first wave of infections in Delhi, the number of tests went down, and so did the tracing efforts. And then isolation again is neither here nor there. If you don't test properly and if you don't trace properly, then who are you going to isolate? And I think there were gaps in those which pretty much resulted in the number of cases in India going up to what, 93, 94,000 a day, right?
Yes, that's I think that's the 7-day average of cases we hit.
Of course, the big mystery for me is why it's come down since then, right? Because now we are at less than 20,000 cases.
Yes, we were at
And I don't. This is the time to. I have many hypotheses, including the fact that not herd immunity, because we're still very far from herd immunity. But I have a feeling that there is that a significant number of people have probably been exposed to this, at least in the metros. The strange thing about how the pandemic has moved in India is that some of the richest states have been the worst hit. right? Delhi, city-state, but still very badly hit. Maharashtra and Mumbai, very badly hit. Maharashtra, of course, Pune, even equally badly hit. Tamil Nadu, another very industrialized state, very badly hit. Karnataka, pretty badly hit. Andhra Pradesh, pretty badly hit. Kerala, and these are states which are richer, which have better health indices than some of the states like Uttar Pradesh and Bihar and Madhya Pradesh and Odisha. So I find it a little strange.
Exactly, and this is something that scientists have grappled with, trying to understand why it affects people so differently. There does not seem, not only does there seem to be this sort of a divide between how it affects people between ages, but also socioeconomic indicators that we are now looking at. There were studies that speculated that is there a negative correlation between, say, even hygiene and sanitation and exposure there, and people sort of being more susceptible to a
Correct. The
pathogen.
ICMR study, right?
Exactly.
Which looked at hygiene and sanitation.
And the thing is, at this point, even with millions, we're going to, we're well on the way to hit 100 million cases globally in a short time. Even with such a degree of spread, we still don't know exactly why this virus behaves in the way it does. Although we are only just starting to figure out how we can sort of save more lives while doing it. And
The good news, of course, is we have vaccines now.
yes,
Right? I mean, and we have vaccines that work.
yes, and that's a journey that's been very sort of eye-catching, obviously, in itself, because the quickest vaccines that were made before this took about 3 years, and we have managed to crunch that time down to 12 months. And the literature and the understanding and the assessment around it suggests that no shortcuts have been taken that should have been taken. Of course, this is still, you're looking at efficacy numbers based on very small number of cases, and then you're extrapolating on to assume how effective these would be.
And it's resulted in a lot of unprecedented behavior because I've never known companies or vaccine developers to previously release details of their clinical testing protocol, right? Hundreds of pages explaining how they are going to go about it because, of course, it's shared with the regulators. But it is not put out in the public domain the way many of the vaccine developers went out and did. And the extent to which even phase 1 studies or of course the phase 3 studies are being studied, it's almost like the wisdom of crowds, right? Crowdsourcing. Every expert around the world is looking at the results and then saying, listen, this doesn't add up, or this adds up, or this looks fine, or this doesn't look fine. The number of papers which are being posted on preprint servers before peer review, which gives people immediate access to that information, it's pretty amazing. But as impressed as I've been with the vaccines, I've been equally disappointed with the drug interventions because initially everyone said HCQ would work, and then of course HCQ was proven to be faulty. Even before HCQ, people were trying with the anti-AIDS drugs, which people thought might work. Again, it was proved that it would not work. Then came remdesivir, which showed some promise in early patients, but then it fizzled out in the big trial that WHO carried out. Plasma, convalescent plasma, which again, I think the best you can say that it doesn't help.
Yeah.
The worst you can say, and I know this should not be misconstrued, the worst you can say is that in some cases, the use of convalescent plasma on some patients could probably result in the kind of mutations that you've now seen in the UK. Because these are immunocompromised patients, and you know it could result in the kind of strain that we've seen in the UK over the last 2 days, which is pretty much set off a panic around the world. But other than steroids, dexamethasone and some of the other corticosteroids, I don't think there's really been a drug that someone has come up with.
The
Of course, the
only,
the
yeah,
monoclonal antibodies are, of course,
which
uh,
famously the US president,
yeah, but they are supposed to be very expensive.
yes, they're extremely, it's completely out of question for LMICs, obviously. But monoclonal antibodies were one of the, basically lab grown antibodies. They were one of the breakthroughs, at least in some manner, because it can obviously save some VIP lives. But dexamethasone was also tied to one of the big understandings that we developed about of the virus, in how we need to stop, at some point we need to stop the immune system from sort of damaging people's organs, because that would often is what would lead to
Correct.
fatalities. And but you're right, where we have not been able to figure out a lot of we've not have broken any ground on therapies as such, apart from some figuring out some indicators that we can use to detect if a patient is about to turn into a very serious condition, like would their blood start clotting, or have their the ferritin levels, have their iron levels dropped so much that they might have problem with oxygen saturation. So these are again small steps that we have taken, but there have been steps that we have taken, etc. But there is still so much more to figure out in terms of the science of it, the
Yeah,
clinic.
but the vaccines, of course, I think sort of offset it. And to me, the really good news is the fact that two of these vaccines, both the Pfizer and the Moderna one, are based on the mRNA platform. Never worked so far. Uh, we are not convinced that it is stable. I remember, and you probably remember this as well, a few weeks back, I interviewed Bill Gates and he said that it'll probably take a few years for that to stabilize as a platform. But the fact is, uh, both these mRNA vaccines work. Uh, and these vaccines could this could open up an entirely new frontier, right? I mean, avenues for finding cures for other diseases.
Yes, and the vaccine race has actually been the most inspiring bit of the positive development in the pandemic, like you mentioned. Because if you just go back to what Moderna disclosed, they partnered with the U.S. NIH, the American Government Agency on Infectious Diseases, and they actually had the mRNA code. They identified and finalized the development bit of it just 3 days after the SARS-CoV-2's genome was uploaded.
This is one of those strange manifestations of the network effect, right? No one is safe till everyone is safe. No country is safe till every country is safe. Which is something that I don't think the countries which are stockpiling the vaccines don't seem to realize. Um, but I still think that it would reduce the chances of infection simply because if you imagine the virus sort of jumping from person to person, the chances of it jumping to someone who's already immune or probably been vaccinated, either had the disease or been vaccinated, is significantly higher as the number of people who have either infected or who've been vaccinated increases in the population. What do you think about India's chances of getting a vaccine? How soon do you think India will vaccinate a significant number of its people?
It all depends on which vaccine candidate really gets the approval. Our best hope, as we all know, is the Serum Institute of India
Correct.
developed
Covishield.
exactly the Oxford AstraZeneca candidate. And luckily, Serum Institute can create lots of volumes in a very small amount of time. They've already stockpiled a lot. So it does look like it's an achievable target for the government to sort of aim for 200, 250, 300 million by next summer. Again, we don't know how the approval process is going to go. A lot will depend also on how UK assesses the same vaccine, because that is where this vaccine, the Serum Institute of India vaccine, uh, the one that Serum Institute is producing, that is going to face its first major test. The UK MHRA is going to sort of
And it's
look at.
supposed to happen now, right? I mean, it's supposed to be happening.
They are already processing this data. They have something called a rolling submission.
Exactly. So they've been looking at the data for some time.
Yes, and so that news could come in at any point of time. There was some controversy with regarding how they designed their trials. They accidentally gave a half dose, and that turned out to be more effective. So that seems to have thrown a bit of a spanner in the works of how it's assessed, because also they've not been very linear with their disclosures. But nonetheless, it's also something that has been assessed with the same degree of scrutiny and thoroughness that we have
Yeah,
assessed
you're
other
right. I
vaccines.
mean, the kind of glitches that you've had in those studies, including the fact that they had to merge data from several trials, uh, from two trials essentially, one in the UK and one in Brazil, probably means that the FDA in the US is not going to approve this vaccine unless there is a study which is done in the US which they can look at.
Yes,
So
the American study is ongoing, and it's going to be a while till that comes out. So the American approval process for the Oxford vaccine is likely to take much longer. That's what a lot of analysts have expected
are you
for the
worried
world.
about this new strain? Do you think things are going to be bad in 2021?
Experts are very much on the fence about it, because they're saying that, see, even if this is not a mutation that right now can defeat vaccines, sort of defeat the immunity that vaccines train us to build, it might, in a hypothetical, set off a chain of evolution that could, in the worst case scenario, lead us to a place.
Sure, but all viruses mutate. So
Exactly.
yeah,
And that's the good thing about, because we know how to deal with these mutations, which is in the influenza vaccines. Every year we
you get a
tweak
new
the.
influenza vaccine, right?
Exactly.
I mean, it accounts for the mutation. And of course, we haven't caught a lucky break there, because sometimes a mutation could also mean a less virulent strain of the virus becoming the dominant one, which pretty much means the problem is solved. What did you enjoy doing the most in 2020?
It was actually inspiring to see a lot of not just journalists but also scientists who just d- deflect their or drop everything and just start looking at the science and making a lot of the science very accessible. Uh, Today was your column's 230th, the 230th number of your column, what we know so far. And we have had this, in this newsroom, we have had this shared journey of trying to understand the science of it. And one of the things with science is that it's uh, fairly linear in terms of how we approach it. It's not debate often. We either know and we can observe and we can replicate based on experiments, or we don't. It's been exceptional to see this journey, to share this journey with people who have just turned to science and have made science accessible. And maybe hopefully it will also inspire a lot of more research and people, kids going into science in the future, and at least science journalism for
No,
one
that's
thing.
true. I think the only way to uh, respond to this pandemic is on the back of science and logic, right? I mean, you have to use science, you have to use data, you have to use logic, and obviously you have to uh, worry about the larger good. But I think, to me, the big message from this year, because when the year started, we didn't have a vaccine, and by the end of the year, we have a handful of vaccines. And to me, all over again, this is another triumph of human ingenuity. To me, it probably explains why humans are the most successful race out there. It explains why Homo sapiens sapiens sort of outlasted the Neanderthal man, right? And the answer to that is just one, is just this term, right? Human ingenuity, and we have survived. Thank you, Binayak.